speaker, Dr. Sandeep whose expertise and insights on emotional intelligence are sure to spark ideas and inspire us today. Dr. Sandeep is a pediatrician with over 3 decades of experience. He is the director of pediatrics at MRR Children's Hospital in Thane, a pioneer in emotional intelligence for children. He founded Equipoise in 2006. This organization promotes mental wellness through EQ and mindfulness. He has conducted workshops globally, including at Harvard University. He has the distinction of collaborating with the Indian Army, NCERT, and the Indian Academy of Pediatrics to develop child mental health programs. A prolific writer, certified EQ coach, and mindfulness trainer, Dr. Kaikar has authored an award-winning book, Zave Bhavanancha Gava. He was awarded the Maharashtra Sahitya Parishad Award. He is invited regularly to speak at national and international conferences on child development and parenting. Please join me in welcoming Dr. Sandeep Kaikar.
Thank you so much for that kind introduction. In the introduction, she mentioned about the pediatrician. Just out of curiosity, how many of you are anybody is pediatrician here? No. So I am the only odd man out, and already you are inclusive. You are including me in this conference, and you are already become inclusive. Thank you so much for this opportunity, the organizers. And as a pediatrician, it has been a long journey, more than 3 decades, but I've been seeing a lot of cases where these developmental disorders as well as learning disabilities are seen in children, and many times as pediatricians we are not so equipped to detect them early, but being quite a bit interested into mental wellness and developmental development of a child, I have been doing a lot of work for last more than 2 decades on knowing about what emotions have a role to play in children, not only children but children with SLD also. So I am going to take you through a journey where now it will be a totally different journey. It will be a journey of emotions, and journey where we will learn about emotions and emotional intelligence and the impact of this on children with SLD, how their learning is getting affected, how impacted, as well as how they can be more motivated to learn also. So I am going to go through all my presentation with few activities also, because I can see that in this auditorium we have a cluster arrangement. I didn't know that. So and emotional intelligence cannot be taught. Actually, it has to be practiced, isn't it? So I thought that few activities we can do together, and that would be great. So let's start with an activity, isn't it? You've taken a nice lunch, and it's a very hard job to do for me to keep you awake. So I am going to give you one word of emotion, and you have to say good afternoon feeling that word. Okay, so for example, I am going to give you a word boredom. You have to say good afternoon. Quite convincing, huh? So now next word, you are probably sad, and you are saying good afternoon.
Good afternoon, sad.
So, and then when you are really excited, you wanted to come to this conference only to listen to this pediatrician. Good afternoon. Thank you so much. So let's start with the little bit of agenda which I have got for you, and it's very simple. It's about emotions in children with SLD, how to harness them, why to harness them. So agenda is like take you through a journey where we'll talk about common emotions experienced by children as well as children with specific learning disabilities. Then about why we should be harnessing emotions. What is the science behind it? Why do we need emotions per se? And why do we need to understand and actually apply this concept of emotional intelligence? What this concept is, because many of you, just out of curiosity, how many of you are knowing about the child psychology? You are doing work in child psychology, all of you? Educators, how many of you are educators? Almost all. And counselors? Okay, great. So we have a diverse kind of audience. So I would like to take you through the concept of emotional intelligence for those for whom it is a little new concept and the science behind it. How to help students of specific learning disability to actually harness emotions, and how to help them utilize these emotions, being aware of those emotions, because that's the major issue which we are facing right now, is the emotions, looking at emotions as obstacles, but they are not, and that's what we are going to talk about it. Role of emotions in motivation of children with SLD, how to cultivate EQ skills, that is emotional intelligence skills in children, and last but not the least, how to apply emotional intelligence in real life as educator, as counselor, and for me it has been a long journey applying it as a as a pediatrician also. And the whole concept and the talk will be based on whatever I have been learning, reading still in last 2 or 3 decades. Dozens of books, a lot of literature, search, and you can see and you can just take a pic also. I think each one of this book, I think all educators as well as counselors and psychologists should read. I have been reading it still, till now I go through these books again and again. They are all gems, and you will learn a lot of about emotional intelligence as well as SLD and how to apply it in that through these books. So let's start with an activity again. You have seen children with specific learning disabilities, all of you, right? Just think of, imagine their life in the society, in the school. What are the common emotions which are experienced by them in the society? Maybe, yeah, you can just throw some words. Frustration,
Isolated.
anger, anxiety, yes,
Fear.
boredom, overwhelmed, anger, annoyed, confusion, anxiety, agitated, curiosity, okay, sorry, loaded, feeling loaded, yeah, envy, yeah, envy, yes, sorry, fear, yes, guilt, okay, sorry, feeling ignored, jealous, happy, yeah, sorry, embarrassment, yes, lonely, yeah, you can see on this tree also a few of them, these feelings, right, yes, love, okay, so you can see the shades of feelings which these children with SLD must be feeling day in and day out, not only in the family, but in the society, in the school. What do they do with them is really going to count. And so these emotions which are experienced by children in the school setting as well as social setting, they are what are called as academic emotions. The emotions experienced by children in the school setting. And Dr. Pekroon has done a lot of work on this. So do we ask this question to our children when they enter the school? How are you feeling? Can I ask this question to you with your permission? How are you feeling right now? Excited, okay. Yeah, I can see that because wonderful conference, nice arrangement, and you are enjoying the sessions up till now. So yeah, pretty well arranged. So we have academic emotions in specific learning disabilities. These are the commonest one. But what is the peculiar thing about emotions in children with SLD are they are more intense, so they feel more heavily, and they have less strategies and tools to handle them. So they cannot manage, they cannot regulate them, they are not so aware about them, and they have more intense than other children. So all these, what are called as negative shades of feelings, as you can see here, sadness, anger, anxiety, helplessness, isn't it? That's one more emotion which probably you may shame, guilt, disappointment, boredom, envy, contempt. So present few of the, of course, positive shades of emotions also. So these emotions are going to impact child's learning, whatever therapy we are going to give. If we don't take care of these and we don't teach them tools to manage these emotions, child is not going to learn at all. So I would like to start first with, what's your paradigm about emotions? So for that, here is a activity again. Just think of, in the group we can do a discussion for 2-3 minutes. Just think of one emotion in your life which is a little difficult to manage. Just think of one. You can make a mental note of it. Okay, you can write down that emotion in your book. One emotion which is difficult to manage, and given a choice, if you had a magical wand. Okay, time up. So, can some tables share about this discussion? Anybody would like to share? Yeah, please. Okay, so you have any helplessness as an emotion which is difficult to, and you want to remove it, and then what was the discussion? What?
Then we are not sure what happens. in specifically helplessness. So these two had a different emotion. So we both said helplessness. The thing is that if in a situation somebody, I want to be able to help but cannot, of course at that point you feel helpless or worthless. But if you take that emotion away, I am not being able to wrap my head around what does it mean if I'm never helpless. So like she said that maybe you're not willing to take help sometimes if you really take away that thing. So that was a very good insight which she said.
Absolutely.
But for me it was from a place where if I'm in a position to help but you're not seeking it. Let's take a parent and child. I feel that if I do this, it'll be beneficial. If the child is not doing it, I'm helplessly watching and don't know. So then it causes anxiety, it causes other emotions in me, but there's no outlet because the child is doing exactly what he or she wants to do.
Okay, so probably that emotion in you is telling you something, but isn't it? That helplessness in you also telling that
I should back
probably
off.
I need help, isn't it? So, is it making sense?
Yes,
Yeah.
it is.
Okay, so all emotions, we have certain paradigm which have been there right from we are born. We have been told about emotions. We are never taught about emotions formally, but informally we are getting trained in the family, in the school, isn't it? And either educated or sometimes not educated about emotions. So we develop some paradigm. What's your paradigm about emotions? I am going to make few statements one by one. What you have to do is, if you agree with those, you just raise your hand. Okay? If you are not sure, you can say like this. If you disagree, like this. Okay? So first statement. Emotions, they get in our way. They will block our thinking, they get in our way. Yeah? Okay? Most of you are agreeing, okay? Emotions make us less effective. sadness, fear, anxiety. Some are, okay. The group is divided, okay. Emotions have to be controlled. Agree, disagree? Emotions are either positive or negative. Agree, disagree? Most of you are probably, few of them are in between, so I don't know whether they are, yeah. Okay, you are not sure, okay, great. Emotions have no place in rational decision making process. Agree or disagree?
Disagree.
That's a hard one, yes, it's a hard one. Don't agree, okay. So now, what the science is telling is all these statements which I have made, these are the paradigms which we live through many a time and we agree to them, but they are old and wrong paradigms about emotions. So what is the new and the latest science of emotions? And those are called new paradigms about emotions, and those are, of course, emotions enable us to navigate. Emotions make us more effective if we have skills. Okay, if we don't have skills, they will take charge of you and you will become ineffective. Emotions have to be managed, not controlled. Control is about suppressing, isn't it? Keeping under the table, or you can under the carpet, you can say. And emotions are messages, they are data, and are contagious. Emotions play a crucial role in decision, even rational decision making process. And there is a science behind it. Okay, I'm not going to go details because that science is huge. But if you see that our brain is like a hand-brain model, if you see like this, there are three parts to it. One, the second is the limbic brain, and the outermost is the thinking brain. Okay, and that's how the evolutionary also we have been evolving like this. First this, and then this. And this is the part which is the emotional headquarters of our brain, is all the time sending signals to the thinking brain. Okay, and there are executive centers, of course. And these executive centers are at fault in children with specific learning disabilities, ADHDs, and all other things. So the regulation is affected. But even in most rational decision-making process and anywhere, the emotional signals are always going, and we are giving valence to our choices. If you have 5 choices, this is better than this, is through emotions only. So even on rational decision making, we have to have that signals coming up from emotional brain to thinking. That's a science for those who are interested in it. But then, yeah, so all these things are the new latest science in emotions and emotional intelligence, which is there according to the new paradigm. Okay, so why do we need to harness them? Why do we need these emotions to be, in children with SLD especially? Why do we need the skills of emotional intelligence? First is emotions have impact on learning, memory, and attention. I remember my own story about, when I was in 7th standard, at that time scholarship exams used to be there, and this was a result day of the scholarship exam. I reached the school and I came to understand that I have missed my scholarship by 1 mark. And I felt devastated that time. And unfortunately, I didn't have any peer, I didn't have any teacher who can, validate me. Everybody was telling, "Arey, next time." Nobody was telling me, "Okay, you seem to be really upset." So what I was feeling was really, really sad, and I didn't have those, skills also to kind of manage that emotion. And what was the impact of that? I didn't learn anything. I couldn't remember anything throughout the day and for next 1 week. Because I was not aware what I was feeling. I was not given that, help or support from people around me to manage that emotion, and I lacked skills. So, and it was, affecting my attention. I was not able to focus, I was not able to learn, I was not able to memorize anything. And that went on for 1 week. Can you see, just imagine a child with specific learning disability having so many intense emotions. And they don't have, skills. of awareness, managing those emotions, what will happen in them? What must be happening in them? Are they going to focus? Are they going to really learn and memorize? Emotions influence relationships because they either attract or repel, isn't it? The emotions which you have will either attract people or repel. Emotions are at the core of motivation to learn. They are at the core, and we'll come to that in next few slides, how they are. And emotions are key to physical and mental wellness. So how we navigate, how we harness these emotions in all children as well as adults, as well as children with specific learning disabilities, is going to be the key aspect of their mental and physical well-being. So we need to be really doing something about these emotions. So Dr. Antonia Damasio, who is the neuroscientist who has done a lot of work on emotions learning, and what he said is really insightful. Instead of looking at emotion as a toddler who upsets the glassware in a shop, we should be looking at it as the shelf upon which the glassware rests. And he's the scientist, he's the neuroscientist who is looking into functional MRIs and children's where activities are there when certain emotions are evoked and what happens when certain emotional intelligence skills are applied. And he is talking about emotions as not the obstacle but the shelf on which it should rest. So all the learning, all the education has to be best, and has to be based on emotions and learning about emotions to start with. These are the fundamental skills which we need, and that's why the statistics as we see in children with SLD is, somebody must have talked about it, but the emotional difficulties which I see every day, those children coming to me are huge. 40% of children with SLDs are estimated to struggle with problems such as anxiety, depression, phobias. 75% have social relationship issues, delinquency and bullying. 70% of the children with SLD have low self-perception, so low self-image. And all these, of course, there are minor difficulties also, which they don't come to you, but they are suffering. They may not be major problems, but they are difficulty in adjusting, difficulty in, managing their aggression, all those things, which ultimately lead to major difficulties later. So this statistics is really sad, and that's why we need to talk about education where there is emotional intelligence is given due importance. So educating the mind without educating the heart is no education at all. And Aristotle said that many years back. Of course, Plato said all learning has an emotional base, and that's what we are just now talking about in first few minutes. And we are talking about children with specific learning disabilities. We are talking about learning. And when learning comes, there are different aspects of learning, isn't it? It's attention, the focus, right? Then it's a memory. And of course, the managing the emotions and actually grasping and absorbing and retaining it and then, reproducing it. So many things are there which are all being impacted by emotions. And if we don't have tools, like emotional intelligence, in children, they will really suffer. They will have, really go down. There will be a lot of issues which are more emotionally difficulties, more emotional issues like anxiety, phobias. I remember a child who came to me many years back, 10 years old boy, who came to me with abdominal pain. As a pediatrician, we examine, take history and examine and everything. First thing, we of course rule out organic problems. So I did everything, testing everything came negative. This child, ultimately I interviewed him, the parents, and I understood that there is something going on in the academics, in the school, which is causing some problems. He had come to me for the first time, so I didn't know his last 10 years how he was. But looking at and doing the psychoeducational assessment and all those things, we diagnosed him as case of specific learning disability, and he was having severe phobia to going to school. And just before the school timing, he used to have the psychosomatic symptom as abdominal pain. We just trained him on emotions of fear. We made them literate about emotion of fear. Guess what? He started going to school, but more than that, his abdominal pain disappeared. And that was kind of revelation that so much of emotions have impact not only on our mind, it's on the body also, physical as well as emotional well-being. And emotional intelligence is the concept which has been there for last more than 4 decades now, and it's been proven in the psychology as the one of the most important concept of 21st century, which will be required more often now when we talk about mental wellness and mental health. And they have defined it properly. So how do you define it? And there are 4 aspects to emotional intelligence. Just going through a little bit of theoretical aspect also, because I know you may not be aware about this concept in detail. Emotional intelligence is the ability to perceive emotions, to access and generate emotions so as to assist thought, to understand emotions and emotional knowledge, and to reflectively regulate emotions so as to promote emotional and intellectual growth. So we have 4 things happening here, 4 intelligent things we can do about emotions. Because first time when I heard this term, emotional intelligence, I thought it is oxymoron, isn't it? 2 opposite words coming together. How can emotions be intelligent? How can intelligent person be emotional? No, it's a cross intersection between emotions and intelligence. How we apply intelligence to our own emotions and those of others is going to matter in life, not only for every child, but especially for children with specific learning disability. So what are these skills? And people have done a lot of work on emotional intelligence. There are many scientists and psychologists all over the world who are doing work on emotional intelligence, and they have found these 5 components of emotional intelligence: emotional self-awareness, emotional self-regulation, internal or intrinsic motivation, empathy, and of course relationship skills. And all these skills, if you see, are related or components of where emotions are applied. The skills are related to emotions, where you are actually perceiving emotions in self and others, you are managing emotions in self and others, you are using emotions to motivate yourself, be optimistic. And when you say a child who is learning disabled, he feels a lot of helplessness and hopelessness. There are a lot of negative thoughts going on in the mind, isn't it? We cannot look into their mind and see, but they are having a lot of thoughts. If those thoughts are more in the pessimistic side, these children have a higher propensity to go into depression. But if we can do something at a right age, at early age, to teach them optimism skills, which can be taught through art, through experiential learning, through activities, through games, these children will resist, and then they won't go into depression. In spite of, they will have skills which will change, they will be help to change the thoughts from really inaccurate, imaginary, negative thoughts to more positive thoughts. So all these skill sets are really important in any child, especially child with emotional intelligence, with specific learning disability. Think of any of this skill is missing. Now just do a 2 minutes, 3 minutes group activity where think of one skill is missing in the child with specific learning disability. How will the child look like to you? Okay, just because this skill is missing in that child. Take any one of these 5 components and just think about it. Just do 2 minutes discussion in the group. How will this child look like as a specific learning disabled person or child, or in any child for that matter? How will he behave? How will he look like to you as a teacher or educator or counselor? Yes, please. You can just discuss in 2 minutes and then we'll discuss. Okay. We are short of time, so we'll just, whatever discussion you have, any table can just...
Sir, actually, if self-awareness is not missing, so it may happen that in school, parents send him very tidily, everything, but when he comes to school, he don't want that lack of awareness, maybe hairband out, belt out, no tidiness in his appearance as well, and this all together Now they maybe get interconnected. Then that happens to the self-regulation again. Because of that lagging of self-awareness and self-regulation, his social skills get impacted because maybe his peer will not interact with him or her. And then even when he feels that what he is not able to express himself, then empathy also get hampered. And with this, all internal motivation will be not be there, maybe because teacher has or other have to handle so many kids, he lag behind sometimes. And due to that, तो असाच राहतो असं म्हणतात ना बरेचदा टीचर्स किती स्वच्छ करा हा तसाच राहतो. मग तसं बिकॉज ऑफ दॅट त्याचं ते इंटरनल मोटिवेशन पण प्रॉब्लेम आहे. They are all interconnected, I think so.
Absolutely, they are interconnected and very well self-awareness. If he or she is aware about what he or she is feeling any moment of time and give a word to it, and that word has to be accurate. If the child is giving a wrong word, the vocabulary is less, already the vocabulary and all those things are hampered, they are deficient in children. On the top of that, emotion words, so that becomes really a challenge for any child with SLD. You rightly say. One more share?
I want to share.
Yeah, please. Yeah, please.
Having a mic in my hand, I'm taking this liberty to talk. Yes. So I have a student coming to me, and I think that she fits in the first one. Meaning, all are there, but first one having lack of self-awareness about knowing the emotions correctly. So everything, the kind of emotional set that she has is crying for all the things. So though something happened in the school that she is not being a part of certain activity, social skills are getting hampered. Initially it is like she starts crying when she comes to intervention classes, and then when I discuss with her, I understand that this is the problem, that she has got this thing. If teacher has scolded her in the class, if she doesn't got anything that she like in the tiffin, if the driver came late for 5 minutes to pick her up, all those emotions are generally not being regulated in the correct way. It is just regulated with cry. So
okay, so that's the only strategy she has probably.
Yes.
To manage sadness is crying, but we can ask what are other strategies you have,
Yeah.
So there are ways of stimulating children's brain to think of different options rather than giving solutions directly. We can ask more than tell. So rightly said. Thank you so much for sharing that important insight. So yes, so you must be having all these children with a lot of issues, where emotional issues are there just because the emotional intelligence skills are missing in them. One, more than one, all. And so we need to know what are these skills which are missing in them, or which skills we need to talk about. Though we have theoretically, I just talked about those 4-branch model by Salovey. It's perception, understanding, utilization, and managing emotions. These are 4 things. But then how does it reflect in the actual real world? And we had done a research at KEM Hospital. One of my students had done research, and which was published in Journal of Postgraduate Medicine, where they actually measured emotional intelligence, EQ, of children with SLDs. And the title was, do school students with specific learning disabilities have lower emotional intelligence abilities? And the conclusion, I'm just going to talk about just the concluding part of that research, which has been published. They say that they have lower emotional intelligence practiced in the maybe social setting as well as in the school setting. In the family, sometimes they will have a better emotional intelligence, but in the other part of the life, that's what that research conveyed, and which is being given support by other studies which have been done all over the world, that children with specific learning disabilities do have lower emotional intelligence than average children. So already children are not educated about emotions. They have already low EQ. As we know, as we are growing in this 21st century, the IQ is going up. General IQ, Flynn effect, that, right? Every 2 decades the IQ goes up by 5 to 10%. But what is happening with EQ all over the world? It's going down all over the world for all children, not only children with SLD. And this is impacting all the children, as we see in the emotional difficulties, the mental health problems which we see in children nowadays. In spite of everything, there is rising depression, rising stress levels, rising mental sicknesses in children, and they are seeing much below at an earlier age, maybe 10 years, 8 years old, getting frank depression, which was never a phenomena in the past. So this is happening in children. Why? Because probably we are not doing anything for first few years, which are so much important. As a pediatrician, that's why I say that when I see a child who is born, he's bundle of joy. Isn't it? We call him bundle of joy. But as they grow, sometimes they become bundle of problems. But there's something going on in between where pediatrician's role is very important, as well as all of you, educators, and those are looking at children from early age. They can pick up certain emotional difficulties, find out the skills which are missing, train them in that, and then we can prevent problems. So I call that as psychological vaccine. And that's what I presented at Harvard University way back in 2014, looking at emotional intelligence as the very important psychological vaccine we can give to children right from early age. And how to give that, we'll come to that in short while. So what are the skills? These are, emotional literacy. So for those who are Marathi speaking, bhavanik saksharta we say, and it's about, knowing the words of feeling, language of feelings, knowing the cause and consequence of feeling, knowing about emotions more, emotion management, the regulation of emotions in self, then empathy, understanding others' emotions, feeling other person, knowing their perspective, and then responding to others' emotions also. So that's empathy, sahasamvedana. Relationship skills, of course, social skills which are required to make and keep intimate friendships, which, in children with SLD, they have a lot of issues because already there are a lot of intense feelings. If they are not supported, they are not skilled, the children around them are going to bully. How many children of SLD get bullied, There's so much, 70% they have said, but I think the statistics must be even more. And if they are not taught about optimism, which is an important skill, where thoughts and feelings intersect, and how we can teach these skills to children. And there's a lot of work going on in the University of Pennsylvania by Dr. Martin Seligman, the father of positive psychology, who has done 3 decades of work on children on optimism, and he's come out with a pain prevention program to prevent depression in children just by teaching formally through experiential learning these skills of optimism. And of course, intrinsic motivation skills, which are also related to emotions. Mind well, all these skills there are 3 facts about them. First is they are all learnable, teachable, measurable, and enhanceable. Very important. As against IQ, which we call a genetic lottery. Up to certain age it will increase and then it will remain fixed. But EQ is something which can be improved all the time throughout the life, and we know the science, neuroplasticity behind it. Second fact, there are distinguishing skills which are beyond IQ. So a child may be really smart. He may be having a lot of good IQ, but he may be lacking in one of these EQ skills, one of the skills related to emotions. And that can impact the child's cognition, learning, everything. And thirdly, these skills emerge in children according to specific timetable, right from early age. And that's a window of opportunity for all of us as caregivers, educators, pediatricians, to hone these skills, cultivate these skills at that time, so that we don't have problems. These children can become really skilled in these skills later on, don't have problems because of that. So, sorry for that. Okay, so our research on 1,500 children in 25 schools funded by ICSSR, this was done in Pune, in 25 schools with collaboration with Modern College and Psychology Department of Modern College. And we found that the skills enhancement, the program which we developed our institute developed to enhance the EQ skills in children. These were not children with SLD, these were general students with, without any issues. But there was significant change, statistically significant change in them after just 4 weeks of training in emotional intelligence. With various skills were taken into account, and there were experiential learning activities which were done with them, and they were given the same questionnaire which was given before and after, and there was significant change in EQ. So why should we have children, and why should we make it a point to enhance these skills in children with SLD? Because children with SLD with higher EQ, they are less impulsive, more focused, better in academics. Because as we see, academic learning is one part, but emotional intelligence and emotional regulation goes hand in hand with academics. So they are better in academics, they're self-assertive, they're better able to cope up with stresses of life, more confident, less violence prone, popular in peer group, and most importantly, healthier and happier. So all these benefits are there. So why we are not including emotional intelligence as the core curriculum in each and every school? That's a secret, that has been always been behind my back of the mind all the time. But I think there has been a lot of work going on in last 1 or 2 decades, and what is called as social emotional learning is coming up, and we have a session on that next, so I'm not going to talk about it, but that is changing the whole structure and the fundamentals of learning and education all over the world. Okay, question. Who are these people? Can you name? You have seen this movie, right? Who is on the left side? Rancho, yeah, and the other? Virus, okay. So just imagine you are a parent of a child with social learning disability, and you have to choose one of these teachers. Both of them are teachers, and you have to choose one of these teachers to go, and whom will you choose? All of you, unanimously, right? Rancho. Why? I am talking about the character, not about the actors, by the way. So why Rancho, not Virus? Yes.
Because understood the child so well, and
Absolutely.
the strength as important factor for identifying the strength and working on its strength.
Absolutely. So he was more aware, more empathetic. So both of them had a high IQ, right? In that movie also, very intelligent genius. But Rancho had high EQ also, poised, outgoing, committed to people, causes, empathetic and caring. As against that, in that character, critical, condescending, inhibited, emotionally bland, lacking empathy, right? So just imagine how we want to be as a teacher, educator, which side we want to go. So there is an impact of parenting style and teaching style on children's emotional intelligence, because how we respond to children's emotion is going to have a lot of impact. And Dr. John Gottman, who was the president of American Psychological Association for almost 2 decades, he has come out with a questionnaire to measure your parenting and teaching style, feeling style, right? And then come out with a strategy or method of dealing with children's feelings in an effective way. And he called it as, and we'll come to that in short while, but before that, I'm going to show you a video. You must have seen this movie also, and just focus on the emotions of the characters here.
Paragraph 3. Read the first sentence and point out the adjectives. Page 38, Ishan. Aditya, just help the boy. Come on, the rest of you, look into your books. Read the first sentence and tell me what the adjectives are. Okay, come on. Let's all mark the adjectives together. Just read the sentence for me. Just read the sentence, Ishant.
ये तो नाच रहे
Silence! Speak in English.
The letters are dancing.
They're dancing, are they? Okay, then read the dancing letters. Trying to be funny? Read the sentence loud and proper. I said loud and proper, Ishan. Loud and proper. Loud and proper.
And we know this clip also. I'm sure that all of you are very emotionally intelligent and you are doing the right thing. But then we'll talk about this clip and the characters. What were the emotions seen in the child and the teacher? Let's talk about the teacher first. What was at the start, when the clip started, what was the emotion? Okay, authoritative a little bit, commanding. Then what happened? How these emotions went on? A little bit of annoyance or irritation was there. And then what was at the end? Rage almost, right? What about child, Ishan? How were the emotions like? Confused, yes. Nervous. Anxious, yes. Fear. Rebellious at that, or defensive, whatever. So now just looking at this, video clip, it was done, in a not so accurate way as you know. What was lacking here in the educator or the teacher? Patience, empathy, okay?
She's not trying to find out the problem with the child.
Absolutely. So she was not actually connecting with the child's emotions at all, isn't it? Why is he doing this? What is he feeling right now? So she was trying to teach, complete the syllabus, right? But she was not connecting with the child's feelings. Yes.
Maybe she just wanted to get her say done. Like, I want you to do this. I don't know whether you are able to do it or not.
Absolutely.
Not
Was she aware of her own emotions also? So she was not self-aware what's happening in her. She was not aware about the students' emotions also. And then you saw what happened at the end. And how did these emotions move in her? From annoyance, irritation, anger, and then rage. That's how emotions move in all of us. They will always be in a milder intensity initially. And we have a Plutchik model, which I am going to show, where the emotions move in us. If we are not connecting with our own emotions, they will increase in intensity. And then they will go at certain level where then become really intense, and then you wake up, That time you know that you are enraged, and then, all the harm is already done. Either you are shouting, you are doing something. So that happens in all of us, and that happened in this teacher also. Could the response be different if she would have been really more emotionally intelligent? As well as in child also, if you are taught certain emotional intelligence skills, would this be different clip? Or probably different result? Yes? Yes. Absolutely. So if the child had, more language of emotions, communicating emotions properly, maybe he would have said that I am feeling confused, isn't it? So that word of feeling, the emotional literacy part was lacking, awareness was not there. Of course, regulation, maybe you can say that, he used fun to regulate his own frustration, but then other things were not there. So that's about, so how did that teacher tackle the intense emotion in Ishan was totally different. And Dr. John Gottman has come out with these 4 feeling styles or teaching or parenting styles where disapproving, the parent who is, parent or teacher is disapproving, low empathy, high guidance, dismissive, totally dismissing the feelings, maybe using distraction as a technique when a child has intense emotion. That's a typical response we do when we are dismissing the emotions. Laissez-faire is when you are acknowledging the emotion, respecting it, but not having the guidance to the emotional response or the behavior. And of course, emotion coaching, which is the real crux which we need to inculcate when we are with children, especially with specific learning disabilities, to address intense emotions in them. So high empathy and high guidance. But how do you do that? Is by this coaching process where you are actually understanding how you deal with your own feelings first, identifying the child's feelings, then if the emotion is really negative shade, then probably taking that as an opportunity to closeness and teaching, listen with empathy of course, and then setting limits and explore possible solutions together rather than you giving solutions. So I'm not going to go into details of this, but emotion coaching process itself will enhance emotional intelligence skills in the child with SLD also. So now that's about teaching and parenting style. We will come to emotions and motivation. How many of you feel that children with specific learning disabilities are really highly motivated? How many of them? Very few? Yes? Yeah. So it's quite low, right? So how do we motivate them? How that intrinsic motivation can come? And Dr. Zixet Mulai has come with a interesting phenomena which can happen in all of us called as state of flow. Have you experienced this, that you are enjoying something doing and you are so much into that activity that you are totally out of the outer world. You are so focused, you are so engaged that you are just looking and doing that activity. That is called as the state of flow, which can happen in children with specific learning disabilities also. But for that, we need to understand these 4 quadrants. And this is about the skills and the challenge. And if I may ask you, if the child has high challenge and low skills, what might be the emotion evoked in this child? Frustration? Anything else? Challenge is high and skills are low.
Avoidance, anxiety.
Yeah, there is uncertainty. I don't know I will be able to do that or not. Anxiety, uncertainty. That's the major emotion which is evoked. Just think of this now. Low skills and low challenge. Sorry. I'm so sorry. So you can see in this 4 quadrants, when you have low skills and low challenge, you have apathy. When there are high skills and low challenge, you have boredom. And we have seen this in children who are really high IQ and they just finish the work and then they start disturbing the class because they're bored. They don't know what to do. So we need to have this kind of quadrant in children with SLD. Is the skills should match the abilities. The skills should match the challenge which we are giving, right? And as you are into this field only, I'm not going to talk about, I'm not an expert in that, but you are doing this already, that the skills and the challenges which you are giving should match the skill of the child, which will then, with which the child will feel engaged and will go into state of flow. That's how the child will get motivated to learn. Okay, so this is important when we talk about state of flow. So now coming to maybe last, how much time I have got? 25 minutes? 25 minutes, okay. So we will talk about now how to enhance EQ. There are certain things which we can do, and maybe we can have one activity here where we'll learn about certain experiential learning methods which we use when we are teaching these skills to children. Of course, it starts at home, right? House, and we say that home is the school of emotions, where children are learning about emotions from parents, from adults, right? And they're watching how my father and mother, when they're angry, what they're doing, what's the pattern, how they're communicating their anger to me. They're watching when I'm angry, how they are responding. All this is going on in the house, and we call it as school of emotions. And of course, I call school as the home of emotions, where we saw so many emotions are evoked in children when they are in school. So we need to, as parents as well as educators, know about what we are doing in front of them, isn't it? And children, of course, need to be taught about these skills where they are more aware and they are able to regulate these emotions. So are we, as adults and caregivers, giving these opportunities and skills to be more aware about these emotions? How do you do that? We have an interesting tool which we give to children, and it's called as feeling thermometer. Okay, we ask them, do you know what is thermometer? Yes, to measure temperature. So do you want to measure your feelings now? Yes, you have a feelings thermometer, you draw a feelings thermometer, they draw, and then we ask these children, how are you feeling now? What they have to do is give a word first in one of these 4 categories: fear, joy, anger, and sadness. One of these 4 families of emotions, you can say. And then if there is something more than these 4, they can actually draw here. And then once they label that, okay, I'm feeling sad, they have to give a valence or intensity also. So I'm feeling sad 3, or I'm feeling sad 5. I may be feeling joy maybe 8. So what they do is, when the class starts, they are asked this question, how are you feeling? Which need to be asked to every child. And there is a discussion where there is non-judgmental communication going on from the teacher, where nobody is talking about why you're feeling this, why you're feeling sad. So they are just talking about and being aware by just plotting on this feelings thermometer. This is the foundational skill by knowing about your own emotions. Can you check your feelings thermometer 3 or 4 times a day? Just sit there, find out where you are, which emotion family, how much is the intensity. Is it very intense, very low? Is it low energy, high energy, whatever? And then talk about the strategies. How do I want to feel now? That's a great question, isn't it? If the child is feeling sad, can you ask, how would you like to feel? And then that journey starts from sadness to whatever the emotion he or she wants to feel. That's the strategy we can use and we can teach them. So this is an interesting tool which we can use. Enhancing emotion vocabulary. This is a basis or fundamental of emotional literacy. Do we talk about emotions? Hardly we talk about emotion words. When we are asked, for example, if I ask you, how are you feeling? You are giving a lot of good words, But then normally when you are asked this question, what do you answer? How do you answer? Okay, fine, isn't it? Even if you are not fine, right? So vocabulary is about the words and the lexicon of emotions, how much we have. And can we develop it? We can develop it right from early age. Talk about feelings. If the child is looking upset, don't say that why you're crying. Say that it seems that you are really upset. That feeling word should come when you're talking with the child. Just giving a label to the emotion of the child is going to do 2 important things in him. First is he will know that whatever I am feeling is called sadness or upset feeling. And secondly, when you name the emotion, you can tame the emotion. That's a science. Where if you yourself, when you are noticing you are feeling really angry, intense anger, just do this. Just notice it and just give a word to the feeling. I notice that I am feeling angry. The emotion, anger, intensity will go down. And there is a science behind it. We will come to that. Because what you are doing is, you are giving a label to your emotion, and at that time, this part of the brain, which is emotional brain, is calmed down actually. The amygdala, which is the part of that emotional brain, gets calmed down by just naming emotion. So enhancing emotional vocabulary is going to have a lot of impact on children's behavior, on their intense emotions. If they have, they will be able to handle them better, because they have now tool where they can name or label their emotions. And this is the Plutchik model, which is the flower model of emotions. Dr. Plutchik is the scientist who has done a lot of work on feelings, what are different emotions, how many shades of emotions we have, and then can you see something which is striking here? Sorry. Oh, sorry. What do you see in the outer circle? There are how many emotions, fundamental emotions are there on this flower? 8, right? These are universally known fundamental emotions, 8 shades of feeling. And what is there outside?
Behavior, according to behavioral outcome.
Yes. Outcome, okay. Just mix these two emotions. There is a different emotion which is coming, right? When you have disgust and anger, you are content. Anger and anticipation, there are aggressiveness. All these emotions mix together and give rise to different shade of feeling. So that's a Plutchik model, and there is an open model also. I'm not going to go into details, but where you understand that how emotions flow in us also. That understanding about emotions is about, how awareness as well as how am I going to feel when I'm feeling annoyed right now. If I don't connect with that annoyance, it's going to go to anger and rage in few seconds. It's going to go there because it's a science. So I need to do something at that stage only when it is mine. Okay, guessing the emotion. So yes, anybody? Yes, joy. Shy, okay, something mischievous, yeah. What's this? Excited. Thinking, what is the feeling? Curious, okay, curious or, okay. Sad, right. And of course happy. So, we have different games played, we have feelings, charades which are played, where they just give non-verbal signals, and the child, they have to guess the emotion, and then we will have one activity here. I need 8 volunteers for this activity. Quick activity, 5 minutes. It's called telephone chain. 8 volunteers here. It's a fun activity, interesting activity. Okay, so what I would like you to do is stand here, back to back, facing that wall, all of you, in a line, one after the other. And yeah, thank you so much. Yeah, you don't need my time, give it. Okay, so now, game is like this, the activity. I am going to give gentlemen one emotion word. Okay? What you have to do is, you will tap the back, she will turn 180 degrees, she will observe you. You have to communicate that emotion non-verbally, and then she will guess that emotion, she will pass on to the next person. And this will go on till the end. Till the end, yeah. Sorry? Okay, we'll give. So he will be given a word of emotion or a situation where the emotion is evoked. He is going to communicate that non-verbally to her. She is going to guess it. She is going to pass it to the next person. This will go to the next person. Yes, absolutely non-verbally. No talking, no words, nothing. Okay. Are you all with me? Just action, non-verbal. Yeah. Okay. Okay, the activity starts now. No, you just tap now first. Now you tap.
You can't see.
No. You just understand it and you have to communicate without saying. Okay, madam. Now you can show it to others, all the audience now, and you have to probably guess the emotion now. Yes. Making sense? What's the word? Not very convincing, right? Okay, thank you so much. So this was just a quick telephone chain activity.
What was the emotion? It started as surprise.
Yeah, it was surprise. Thank you so much. Yeah. It went on to a little bit of, happiness and terror and all those things, but ultimately, yeah. So, we can have different ways of teaching children and educating children of special learning disabilities with about emotions by using emotion cards, by emojis, whatever, just name the emotion in a story. On a television, maybe you are watching the television with the child, if you are a parent, and you just stop there and ask, what is this character feeling? What is the other character feeling? If you would have been in that position, how would you would have felt? What would you do? What would this character do next? You are educating the child about emotions through stories, through making the television viewing more active, isn't it? Just rather than passive viewing. So you can do a lot of good things by using this. There will be direct teaching, explicit, where you are asking about a lot of questions when you are feeling overwhelmed, surprised. What is the cause of it? How do you normally respond when you are overwhelmed? And what strategies you use? What are other options? Is that strategy helpful or harmful? All these questions we can just talk about it with the child, and rather than telling them, their brain gets stimulated, they think about themselves, and then that reflects in the behavior. So that's explicit learning, and of course implicit it through how we give emotional labels, like for example emotion coaching method. We are teaching children about emotions and emotional intelligence also. And this was the thing which I mentioned, name it to tame it. Putting feelings into words is going to decrease the activity in the amygdala. And this was a research which was published in PubMed. So there is a lot of science going on behind this concept of emotions and emotional intelligence. They are not just abstract things, they are there in the form of neuropeptides in all our body. There are more than 90 neuropeptides which have been actually discovered, invented by scientists. One emotion with one chemical signature, one or more. Okay, and you know what exactly. And of course, these neuropeptides have impact on all our body. Feelings have impact on all our body, right? So when you are feeling angry or when you are feeling fear, there are palpitations, there is heartbeats start increasing, there's sweating. All these emotions go there and attach to the receptors, and we have these changes in the body. We call them feeling fingerprints. And children can learn about their emotions by just talking about where do you feel your anger, most, or when you see somebody angry, what do you see in him or her? So some questions which are talking about these feeling fingerprints is going to help in knowing. Talking about emotions freely in the family, when home environment is so much important. We talk about so many things. For example, we talk about sports, we talk about cultural things, music, they learn about it. But if we talk about emotions, they will learn about emotions, isn't it? So we do this activity, and we tell parents also to do this activity called as highs and lows of last 1 week. Okay, where they all sit in a circle and everybody shares his or her highs and lows. What are highs? When I really felt excited last 1 week. How was I? What were thoughts? How was I feeling exactly? Who was with me? What did I do? What was my pattern? And then second, when I was feeling really low, sad, disappointed, frustrated, who was with me? And we talk about that. And then the next person comes in the activity, and then it passes, and then comes to the child. Children are not used to doing this, right? So they may be given pass initially. But as you repeat this activity every week, at certain time, these children will feel that it's okay to communicate feelings in your family. Nobody is judgmental. Nobody is talking about why you're feeling this way. It should be this way. You should be feeling this way. We'd say that, isn't it? These emotions. And then if you're validating these feelings and just being open and accepting and respecting emotions in the family, the child will learn about emotions. And he will get all those words. Co-regulating emotions with them. This is most important. Because when a child is really feeling intense feelings, how do you feel if a child is come really, angry, and you are there in front of him as a educator or whoever? How do you start feeling inside you? You feel the same emotion sometimes? These emotions are contagious, and I'm not talking about bacteria and virus. Emotions are signals which we are picking all the time from others, and the science says that if 3 people are sitting in a room for more than 2 minutes, the dominant emotion of one person will go to other person in just 2 minutes. Whether you are aware of it or not, that's the most important thing. So, if we are with a child who is really having intense feeling, and if we are not regulating our own feelings first, that oxygen mask concept, in the aeroplane is mentioned. So we regulate our emotions first, and then go on to manage the emotions in the child. And we teach them different emotion regulation strategies. One of them is traffic light system, where we ask how many lights are there, what are the colors, when you stop, think and choose. Okay? When you are having intense emotion, just stop at that time, pause. Because these emotions are there in our body for 4 to 6 seconds. And then they get dissipated. But there is a choice. We can create more of it by thinking the same thing again, or not using the right strategy. So if we stop, give a pause, we call it 6-second pause. Because in 4 to 6 seconds, the emotions, they actually get lesser intensity. And this is, we have been known about this by our grandmothers used to tell, count to 1 to 10, right? Ek te da akde mana. Count 1 to 10 when you are angry. But it doesn't work sometimes, isn't it? Why? Because it takes lesser time, lesser than 6 seconds if you are counting in your own language. Start counting in German language. Okay? It will take more than 6 seconds. That 6-second pause will work in you if you are really feeling angry. So traffic light system, you pause, stop first, think about what's going on, think of options, and then green is you choose an appropriate action or then act. So that's about, we can actually have this experiential learning to them, ask them to make it, and then they learn about emotion management. There are several activities, several experiential learning methods which we can use to cultivate emotional literacy in children by talking, by through stories, by certain games, activities, by showing them video clips and asking about to label those emotions in the characters and then talking about it. So many ways we can do multisensory, especially in children with specific learning disabilities. We have to use multisensory method where they can understand them better, and then they can be, we can really enhance these skills. Role play, of course, EQ skills yourself when you are with the child. This is going to really help. Screen time is one of the things which is the 21st century, you can say, really a thing which is actually technologically speaking, we are at an advantage sometimes, but then too much of screen time is causing a lot of problems, and the focus and the attention is the real problem of 21st century. As we know that there is a new entity which has come up in the psychological world, what is called as continuous partial attention syndrome. So you are attending to many things, one after the other, partially. Okay, so you are reading and there is notification, your attention goes to the mobile, then goes to the mobile television. Though, so attention is getting pulled by outer things, one after the other, partially. So continuous partial attention syndrome, and of course screen time, we know what are the effects we have seen in COVID times also. I have been in pediatrics seeing a lot of cases of virtual autism nowadays, at least 2 or 3 cases every week. And we just tell them to stop screen, all the symptoms regress. They have mild to moderate symptoms of autism which are seen, but then they just regress by stopping the screen. So screen time check is very important if you want to really enhance, because face-to-face communication is hampered, isn't it? When we have virtual world more in the form of screen. In the school and in the family, can we have a feelings policy made that helps in creating that emotional climate where children can not only thrive but flourish, And what is this feelings policy? Make a feelings policy where ask them, sit in a circle and ask all the stakeholders, in a child also, how do we want to feel as a family? The words can come, feeling understood, feeling cared, feeling included, feeling loved. Can you throw a few words? As a family, you want to feel happy?
Safe.
Sorry? Safe, yeah. Belonging, yeah. Understood, cared, yeah. Contented. So many words will come, and then you write those words, and then next question, what we can do together to experience these feelings as often as possible. What we can do together, right? So actions which we can do to create these feelings, choose feelings and then create them with certain by certain ways. And what can be done if we are not leaving the policy? Probably somebody is feeling misunderstood. What the strategy is then? What we can do? So this is an interesting way of creating that emotional climate in the classroom as well as in the family to feel that feelings. Here, when we are talking about inclusive classroom, especially, we need to have this, because there are children who may not understand this child's feelings, and when he talks about his own feelings, others will also understand, okay, he's feeling probably excluded, and how can that be used? Of course, empathy skill has to be enhanced in children who are the peer group, where they can then connect with the child and feel those emotions in themselves and then help them in a better way. And last but not the least, we need to teach each and every child. Can you see something on this? What do you see here? And this happens in all of us, right? Our mind is like a chatter, so many thoughts, so many things, thinking about the future, about the past, and the mind is never in the present moment, most of the times. And they have found that almost 50% of the times, the mind is either future or past and not in the present moment, here and now. It's called mind wandering, which is not an abnormal phenomena. It's there in all of us, even the marathon Tibetan monks also. But then there is a way to create that focus and attention by using this important technique of mindfulness meditation. We can teach this to children, and I tell parents to teach them even to toddlers. How do you do that? Breath buddy meditation. So what you do is ask them to lie down, keep a soft toy on the abdomen, and when the soft toy goes up, the child has to say up. When the soft toy goes down, the child has to say down. So what the child is doing is actually focusing on the breath sensations. But it's difficult, right, at 2 years to focus on the breath sensation. So we use soft toy as a buddy, breath buddy meditation, and that helps in improving the focus, improving the attention, and child feels less stressed out also. It has got good impact on so many things. Because what is the concept and neuroscience behind meditation and mindfulness is, we are actually activating the executive center in the brain. Coming back to the, this model of hand-brain model, the front part which is there behind the forehead is called as prefrontal cortex, you must be knowing. That's the executive center, out of which middle prefrontal cortex is where is the execution is more. The regulation of emotions, regulation of the behavior, everything is through this part. And that gets activated actually when we are doing mindfulness meditation. And so we need to teach this mindfulness, and it should be part of our education system, especially in children with specific learning disabilities, because they have issues with attention, they have issues with impulse control, and of course there are other emotional comorbidities which are there. So that this kind of breath body meditation, or you can have another way, is mindfulness glitter bottle. Ask them to make a bottle where you pour water and put the glitter and just watch the glitter, and that's it. And tell them what are different ways so that the water will get clear, and at the end of the activity that the glitter settles and you can see through it, and then you can equate that and relate that to your emotions, your daily life, your thoughts, because glitter is like, if you relate it to your mind, it's like thoughts, emotions, these are all glitter, isn't it? And if you are just observing them, they will settle. But we don't do that. We judge them, we try to throw them, we try to suppress them, we do a lot of things with them, and in a way, what we are doing is distracting our mind from the present moment to either future or the past. So being in the present moment, non-judgmentally, is what is mindfulness. No big deal actually. And you can do it anywhere, anytime. There is no need to sit, close your eyes and do this. You can do mindfulness when you are cooking, when you are driving, when you are jogging, anywhere. You have to just focus on the object, non-judgmentally, just observe the sensations, right? And it can be done formally also. I think I will end with this quote where, very important, especially when we are talking about emotions and emotional intelligence in children, they may forget what you said, but they will never forget how you made them feel. And this is, some quote which is being used all over the world, especially when we are talking about, especially when I use it as a pediatrician in my clinic, how the patient goes and how he is feeling is going to bring him back again to me, isn't it? So they will forget what you said, but they will remember how you made them feel. With that, I just close my session. Thank you so much. If you have any questions. This book is about those who are Marathi language readers. जावे भावनांच्या गावा हे पुस्तक सगळं याच्यावरच आहे, इमोशन्स, इमोशनल इंटेलिजन्स अँड पॅरेंटिंग. इफ यू वॉन्ट, इट्स अवेलेबल ऑन Amazon. If you want to connect with our work and want to ask me questions, we have website and phone number also. Thank you so much.
Thank you so much, sir. This has been an amazing session. I want to just share actually, and it takes a lot of courage at this point, but something that kept coming back to me while I was listening to you was that just the lack of not having an emotional vocabulary or a space to actually put forth how one is feeling. One very scary consequence is that sexual abuse goes unaddressed in children. And this is one of the first steps to kind of address that problem. Because a child, one does not have the vocabulary, and I'm thinking back in time right now. You don't have the vocabulary, you don't have the safe space. Safe space aside, even with your parents or your teachers making you feel absolutely safe, you do not, and the vocabulary that you do have is not conducive to the social setting, the environment. How did I feel? And more often than not, the response is that you freeze. And then you are frozen in time, or the event or the incident or the situation gets frozen in time. So I wanted to just bring this up because I felt that this was so in the face. I mean, there are so many emotions that one must be able to express. With this one, it goes untouched, unspoken of for years, decades sometimes in a child. Thank you.
Absolutely. Thank you so much for sharing that. It's really important, to have this vocabulary, and as you rightly said, it could prevent lot of issues if we just have that vocabulary developed early. Thank you so much for sharing. Yes, anyone?
Questions?
Thank you.
Thank you, sir.
I sincerely appreciate your insightful talk on the emotional journey of children with specific learning disabilities and for overall for all of us. Your emphasis on harnessing emotions as a motivating factor was truly eye-opening. It was especially impactful to learn how EQ often plays more important role than IQ in the students with specific learning disabilities, which help them building resilience, confidence, and meaningful connections. Your discussion on the role of teachers and parenting styles in cultivating EQ skills were particularly invaluable. The way educators and parents model emotional regulation, encourage self-awareness, and create a supportive environment that can make a lasting difference on individual's mind. I also found your inputs on emotional coaching, especially practical guiding children through their feelings, validating their emotions, and teaching problem-solving skills, various strategies that you have given us. For sure, those will be helpful in our future for all of us and for children as well. We are definitely in a state of flow in your session. Thank you shedding light on this important aspect of education of emotion, and your expertise really brought a new perspective today. Thank you so much.